we're now fortunate to have Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, joining us. Thanks so much for your time, Dr. Fauci. I'd like to pick your brain about a number of aspects of this pandemic. Let's start with Christmas, just a little more than 3 weeks away. The U.S. currently has about 100,000 Americans hospitalized due to COVID. We're still waiting to really get the full scope of the fallout from Thanksgiving. So what's your message heading into these next holidays when, once again, people are hoping to gather with their loved ones?
Yeah, I think the message is going to be very similar to what we said over Thanksgiving. If at all possible, curtail traveling. When you have the kind of celebration, which I'm sure we all want to have at Christmas and Hanukkah, to limit the number of people as possible and try to get just the people who are the immediate household. I know that's very difficult. You want to have friends and other people come over the house and visit, but unfortunately that puts you in a precarious situation, because we expect to even see, based on the result of the travel and the congregating during Thanksgiving, I would not be surprised at all. In fact, it's likely we're going to see a blip in the sense of a surge upon a surge, which usually comes about 2 to 3 weeks after the event. So 2 to 3 weeks from just this past weekend, which was the Thanksgiving weekend, would put us right before Christmas when people start to travel. So it really is a precarious situation, very unfortunate for us, but I think we just have to do the kinds of things to limit the possibility of there being spread. Limit travel, limit indoor congregation, keep the number of people that come into your house very limited, hopefully just to the immediate family, and do all the other things we talk about. Mask wearing, physical distance, avoid crowds in congregate settings, wash your hands as often as you possibly can. It's tough to do, I know, but this is a very critical time for us right now.
But what do you say to Americans who look at images of, say, the White House holiday party and the large number of people who are gathered inside and wonder, why can't we do the same thing?
Well, because if you did, you'd be putting yourself at risk. You know, I've always said, and I'll repeat it here for the viewers right now, that any kind of congregate settings where you have large numbers of people indoors, particularly without masks, is a very risky situation. It doesn't matter where you are, who you are, or where you're doing it. It's a risky situation. So I encourage the people of the country not to do that.
ABC News has obtained a private memo to governors from the White House Coronavirus Task Force, and it comes with the urgent warning to Americans under 40 who had Thanksgiving with anyone outside their immediate family to assume that they have become infected and, quote, you are dangerous to others. You've been so vocal warning Americans about the dangers of COVID. Why aren't these task force reports made public?
You know, I'm not sure. Those are just internal memories, but I can make it public right now and tell you just exactly what's there. We have to be really very careful. What we call community spread is generally spread by people who are not symptomatic. And the chances of a younger person who's infected of being non-symptomatic is certainly pretty good, like about 40 to 45% of the infections are people who don't have any symptoms. That's the innocent, inadvertent spreading of infection. So that's what we mean by that. If you're going to be in a situation where either you've traveled, you've been at an airport, you've been at a crowded train station, you've been in a congregate setting, really you need to assume, as strange as that seems, you need to assume that you might actually be infected even though you have no symptoms. And for that reason, wear a mask so that you could protect those around you, particularly if when you're going home to the family, you might have an elderly individual or someone with an underlying condition. If they get infected, it may not be like you, namely with no symptoms. It may be they'll wind up in the hospital with a serious consequence. That's happening all around us. This isn't made up. This is the reality of what's going on right now in our country. We had over 2,000 deaths yesterday. We have between 100 and 200,000 infections per day. We have 99,000 hospitalizations. That's real stuff. That's not fake. And that's the reason why we give these kinds of warnings of what people need to do.
And you talk about real stuff. Of course, the CDC has now officially reduced the quarantine guidelines for Americans with a negative test to 7 days and 10 days without a test. Is this change backed by real science?
Well, you know, it's backed by real science, but it's also backed by expediency. For example, we're finding out that when you have a very long quarantine period, people are reluctant to get tested because maybe because of their job, their employment, their financial situation. They can't afford to be out if they're positive for 14 days. So if you lessen the quarantine period, 10 days without a test, 7 days with a test, it might encourage more people to get tested when they're in a risk situation. So the total net effect may be you may be protecting more people by shortening the quarantine period. That's the rationale behind that decision.
And turning now to the vaccine, we know the Pfizer vaccine was approved in the UK today. If that and Moderna are approved in the coming weeks, are you concerned at all about the long-term side effects of a vaccine since we only have had a few months of data on it? And is it an acceptable risk knowing that we will learn more about the vaccine in the months to come?
Right. You know, it's an overwhelmingly acceptable risk. Vaccines historically have been extraordinarily safe when you look at the risk-benefit ratio. And then one thing that I think people need to understand, it kind of slipped by in all the discussions previously, but the overwhelming majority, something like 90+% of the adverse events that occur between maybe 30 and 45 days from the time you get the injection, which is exactly the reason why the FDA says they will wait 60 days before the time half of the people got their last dose to see if there are any adverse events. So built in and baked in to the process of when the FDA is even allowed to issue an EUA, you've already baked in those 60 days there. So that's pretty safe, which makes us pretty confident. You never have an intervention that's 100% risk-free. But when you do a risk-benefit ratio, the benefit overwhelms any risk.
Any idea when you think that you'll personally receive a dose?
Well, I'd wait my turn. I mean, my age puts me in the elderly group. I'm also a healthcare provider, so there are kind of two things right there. I will wait my turn, and when my turn comes up, I'll tell you I definitely will get vaccinated, and I would recommend that my family gets vaccinated.
Were you surprised that an effective vaccine was developed so quickly? And you've researched so many other viruses like HIV, AIDS. What's been the biggest game changer? Is it the messenger RNA technology?
You know, I wasn't surprised at the speed because I've been talking about this for months, that the extraordinary vaccine platform technology allowed us to do things in a matter of weeks to months that previously took us several years to do. So that was not surprising. Also, the enormous amount of investment that was made to pre-purchase vaccine doses to be able to give them right away. What I was pleasantly surprised at was the extraordinarily high degree of efficacy of the vaccines, both the Moderna and the Pfizer. You know, 94 and 95% is almost as good as it gets. That's almost as good as measles, which is the gold standard of a highly effective vaccine. So that's really good news that actually pleasantly surprised me.
So many Americans, as you well know, have put their lives on hold pretty much this entire past year as these vaccines are rolled out, though. Are you able to kind of look into your crystal ball for us as far as what the summer and fall may look like ahead? I mean, still masks and social distancing as late as next fall, you think?
Yeah. Well, getting us back to normal is going to depend on two things. One is going to be continuation of a baseline degree of good public health practices. The other is we already have a highly efficacious vaccine. In order to make that an effective program, you have to have a rather large proportion of the population getting vaccinated. I would say that would be at least 70% and maybe more of the U.S. population. If we can do that, we can get a blanket of immunity over this country that as we get into the summer and early fall, we could be very close to normal. Not exactly, but really close to normal, so that there's not a problem with children going to school. There's not a problem with doing many of the things we do normally that we've not been able to do over the last several months. So that's the reason why we encourage people to look at the data, which is sound data about the safety and the efficacy of the vaccines, and go out there and get vaccinated.
And lastly, congratulations are, of course, in order. You're the cover of People magazine's most recent issue as one of their People of the Year. And looking at the cover here, you say, I believe we can turn this around. What gives you this hope after such a dark year?
You know, I think it's a combination of what we know works, the public health measures, but also the extraordinary lift that we're going to get, that help that I say is on the way with a vaccine. This vaccine right now, it's its degree of efficacy. Getting it within less than a year of the discovery of a new virus is beyond unprecedented. It's most extraordinary. So that's the thing that gives me hope. But also, I think the bravery of the American people and how we've been able to handle this as a nation, particularly the healthcare providers who put themselves and their families at risk every time they go to work in the morning. They are really heroes.
Well, we see you as well as a hero, Dr. Fauci. Thanks so much for your time, for your steady hand on the wheel during all of this, and thanks for coming on the show tonight.
Thank you. Good to be with you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.